Healthcare costs are a growing concern for older adults, especially as we look ahead to 2025. For many in retirement, medical expenses make up a significant portion of their budget, and these costs are expected to keep rising. Whether it's paying for Medicare premiums, managing out-of-pocket expenses, or preparing for long-term care, understanding how to plan for healthcare in retirement is more important than ever. As we age, medical needs often increase, and with that comes higher costs. Medicare provides a valuable foundation, but it doesn't cover everything, and out-of-pocket costs can add up quickly. It's essential to know what to expect from Medicare premiums and how to budget for additional expenses, like copays and deductibles. Long-term care is another critical piece of the puzzle, as it's one of the most expensive aspects of healthcare in later life. In this video, we'll cover the key issues surrounding healthcare costs in 2025, including how Medicare works, what out-of-pocket expenses to plan for, and the rising costs of long-term care. We'll also explore practical strategies to help manage these expenses and protect your retirement savings. Let's begin by taking a closer look at Medicare and what changes older adults can expect in the coming year. Breaking down the 2025 Medicare landscape. Medicare is the primary healthcare system for adults over 65, covering a wide range of medical services. However, it's not free, and understanding how it works can help older adults plan better for rising costs in 2025. Let's break it down, starting with the basics. Medicare is divided into different parts. Part A covers hospital stays, skilled nursing care, and hospice. Most people won't have to pay premiums for Part A if they've worked long enough and paid Medicare taxes. But there are still deductibles and coinsurance costs to consider. Part B takes care of outpatient services like doctor visits, preventive care, and some medical equipment. In 2025, premiums for Part B are expected to rise, which means budgeting for this will be even more critical. The premium is income-based, so higher earners will see a bigger increase. It's important to review your income status yearly to understand how much you'll be paying. Part D covers prescription drugs. It's offered through private insurers, so costs vary. In 2025, the trend of rising drug costs is likely to continue, which means Part D premiums may see an uptick. There's also a coverage gap, known as the donut hole, where beneficiaries might have to pay more out-of-pocket for their medications before catastrophic coverage kicks in. To manage some of these expenses, many opt for Medigap. This is a supplemental insurance plan that helps cover costs like deductibles and coinsurance that Medicare doesn't fully cover. These plans can be helpful, but they come with their own premiums. Medigap doesn't cover everything, so it's important to understand what it does and doesn't help with. This brings us to out-of-pocket expenses. Even with Medicare and supplemental insurance, older adults need to budget for these additional costs, which can quickly add up. Out-of-pocket healthcare expenses. What to expect? Out-of-pocket healthcare costs can be a significant concern for older adults in 2025, especially as medical expenses continue to rise. Even with Medicare coverage, there are costs that beneficiaries must pay directly, and these can add up quickly if not planned for. Let's break down what to expect. One of the most common out-of-pocket costs is copays. These are fixed amounts you pay for certain services, like doctor visits or prescription drugs. For instance, a routine checkup might have a small copay, but specialized care or medications could cost more. As healthcare prices rise, it's likely that copays will follow suit. Next are deductibles, which refer to the amount you have to pay before your Medicare coverage kicks in. Each part of Medicare has its own deductible. For example, Part A, which covers hospital stays, comes with a deductible for each benefit period. In 2025, these amounts are expected to increase, which means planning for these higher costs is essential. Then there's co-insurance, where you share a percentage of the costs with Medicare. For example, after you meet your Part B deductible, you'll generally pay 20% of the Medicare-approved amount for services like physical therapy or lab tests. For more expensive treatments or procedures, this percentage can add up quickly. Surgeries, physical rehabilitation, and advanced imaging like MRIs are examples of services that can come with high out-of-pocket costs. Without careful budgeting, these expenses can become overwhelming. Now, as healthcare needs grow with age, it's important to think about long-term care costs. These expenses go beyond regular medical care and often aren't covered by Medicare. Long-term care costs, the silent budget buster. Long-term care is one of the biggest financial challenges older adults can face, and it's often overlooked when planning for healthcare expenses. In 2025, the costs for long-term care services are expected to rise, making it even more important to factor these into your retirement budget. Let's start with assisted living. This option provides housing and some daily care, but it doesn't offer the same level of medical care as a nursing home. In 2025, monthly costs for assisted living are projected to average between $4,000 and $5,000, depending on location and level of care needed. While this can be a less expensive alternative to nursing homes, it still adds up over time. For more intensive care, nursing homes are the next step. These facilities provide round-the-clock medical care for individuals who need constant assistance. In 2025, a private room in a nursing home could cost upwards of $9,000 per month. For many, this level of care is necessary, but without a plan, it can quickly deplete savings. In-home care is another option that's gaining popularity. Many older adults prefer to remain in their own homes, receiving support from caregivers. The cost for in-home care in 2025 is projected to average over $25 per hour, depending on the services provided. While this might seem more flexible, it can still become expensive if round-the-clock care is needed. For those who qualify, Medicaid can help cover long-term care costs, especially in nursing homes. However, eligibility is income-based, and not everyone will meet the criteria. It's important to understand whether Medicaid could be an option for you. Strategies to plan for healthcare expenses, smart moves for 2025. Managing rising healthcare costs is a challenge for many older adults, but there are practical strategies to help reduce the burden. It's all about planning ahead and taking advantage of tools designed to lighten the load. Let's start with a key financial tool that's often underutilized: health savings accounts, HSAs. An HSA is a tax-advantaged savings account that you can contribute to if you're enrolled in a high-deductible health plan. The money you put into an HSA can be used to cover qualifying medical expenses, from prescription drugs to doctor visits, even into retirement. One of the biggest benefits of an HSA is that it's triple tax-advantaged. Contributions are tax-deductible, the money grows tax-free, and withdrawals for medical expenses are tax-free. If you start early, this account can be a significant buffer against future medical costs. Another important consideration is long-term care insurance. While it might seem expensive up front, this insurance can be a lifesaver if you need extended care, either in a facility or at home. Long-term care insurance helps cover the cost of services that Medicare doesn't, such as nursing homes or in-home care. Purchasing this type of insurance earlier, when premiums are lower, can provide peace of mind for the future, especially with long-term care costs expected to rise sharply in 2025. For those seeking more flexibility, Medicare Advantage plans could be a helpful option. These plans, offered by private insurers, bundle together Medicare Parts A, B, and often D, and frequently include extra benefits like vision, dental, and hearing coverage. Some plans even offer wellness programs or gym memberships, which can help reduce overall healthcare spending. Medicare Advantage plans often come with lower out-of-pocket costs, but it's important to carefully compare plans to ensure the benefits match your healthcare needs. Of course, budgeting is a key part of managing healthcare costs. This means planning for both expected and unexpected expenses. It's wise to set aside funds specifically for medical costs in your retirement budget, whether it's for routine care, medications, or long-term care. Reviewing your Medicare coverage annually can help you make adjustments to your plan as your health needs change. Financial planning for retirement isn't just about saving, it's about protecting those savings. By using tools like HSAs, long-term care insurance, and Medicare Advantage, you can shield yourself from rising healthcare costs. Managing unexpected medical costs, being prepared for the unknown. Unexpected medical costs can throw even the most carefully planned retirement budget off track. Medical emergencies, from sudden hospitalizations to unplanned surgeries, can lead to significant expenses beyond what regular Medicare or insurance plans cover. This is why preparing for the unexpected is just as important as budgeting for routine healthcare. One of the most effective ways to handle these surprises is by setting aside an emergency fund, specifically for medical expenses. Having a dedicated fund can help cover sudden costs without dipping into your main retirement savings. It's smart to aim for a few months' worth of living and healthcare expenses in this fund to provide a solid safety net. This way, if an unexpected surgery or medical procedure arises, you'll have a buffer to protect your long-term financial stability. Another option to consider is gap insurance, such as a Medigap policy. Medigap is designed to fill in the coverage gaps that Medicare leaves, helping with copays, deductibles, and coinsurance. While this supplemental insurance requires a monthly premium, it can significantly reduce out-of-pocket costs if you face a major medical emergency. For those who want additional protection, it's worth comparing different Medigap plans to find the right fit for your health needs and budget. By taking proactive steps like building an emergency fund and exploring gap insurance options, you can prepare for medical costs that might otherwise derail your financial plans. Unexpected healthcare expenses are unavoidable, but with the right planning, they don't have to become a financial crisis. Navigating prescription drug costs. What's coming in 2025? Prescription drug costs are projected to rise in 2025, continuing a trend that has been challenging for many older adults. As drug prices increase, it's crucial to find ways to manage these costs and keep them from overwhelming your retirement budget. One effective strategy is opting for generic drugs. Whenever possible, generic medications have the same active ingredients as their brand name counterparts, but are often available at a fraction of the cost. Asking your doctor about generic alternatives can help lower your overall prescription expenses. Another option is using mail-order pharmacies, which can offer convenience and savings. Many insurance plans provide discounts for ordering medications in larger quantities through mail-order services, reducing both the price and the number of trips to the pharmacy. This can be particularly helpful for those who take long-term medications. Medicare Part also plays an essential role in helping manage prescription drug costs. Part D plans are offered through private insurers, and coverage varies depending on the specific plan. In 2025, it's important to review your plan annually to make sure it still covers the medications you need at a reasonable cost. With rising prices, switching plans might help you find better coverage and save money. Managing prescription drug costs requires careful planning and staying informed. Now, let's move on to how healthcare expenses, including prescriptions, can have tax implications, and how to maximize the benefits of tax deductions in retirement. Tax implications of healthcare spending. What older adults need to know. Healthcare spending can have a significant impact on taxes for older adults, and understanding the tax implications can help reduce the overall financial burden. One key way healthcare costs affect taxes is through deductions. If your total medical expenses exceed a certain percentage of your adjusted gross income, currently 7.5% for most taxpayers, you can deduct these expenses on your federal tax return. This includes out-of-pocket costs like copays, deductibles, premiums, and even some long-term care expenses. Keeping good records of all your healthcare spending throughout the year is important to take advantage of these deductions. Another valuable tax benefit comes from health savings accounts, HSAs. If you have an HSA, contributions are tax-deductible, and withdrawals for qualified medical expenses are tax-free. This can help offset healthcare costs in retirement while also reducing your taxable income. Even though HSAs are only available to those enrolled in high-deductible health plans, the tax advantages make them an excellent option for covering healthcare expenses. Maximizing tax deductions and utilizing HSAs can ease the financial pressure of rising healthcare costs. It's a smart move to consult with a tax professional to ensure you're getting the most benefit from these opportunities. Planning for end-of-life costs, an often overlooked expense. End-of-life care, whether through hospice or palliative services, can be emotionally and financially overwhelming. In 2025, the average cost of hospice care is expected to range from $300 to $800 per day, depending on the level of care required and the location. For those needing extended care, these expenses can accumulate quickly. Palliative care, aimed at providing comfort for those with serious illnesses, can also become costly, especially if hospital stays or specialized treatments are involved. To help manage these expenses, some older adults turn to life insurance policies that offer end-of-life benefits. Certain policies allow you to access a portion of the death benefit while still alive to cover medical and hospice costs. Additionally, some long-term care insurance policies may include provisions for end-of-life care, depending on the coverage terms. These options can provide some financial relief during an already difficult time. Planning for these expenses is crucial, as they often come unexpectedly and can strain even a well-prepared retirement budget. Taking steps now to ensure coverage for end-of-life care can help protect your family from a significant financial burden. The importance of reviewing your healthcare budget annually. Reviewing your healthcare budget annually is essential for staying ahead of rising costs and ensuring you're fully prepared for changes in your health or Medicare policies. As we age, medical needs can shift unexpectedly, and Medicare premiums, deductibles, and coverage options may change from year to year. Adjusting your budget to reflect these changes can help prevent financial surprises down the road. One practical step is to reassess your Medicare plan annually during the open enrollment period. By comparing different options, such as switching to a Medicare Advantage plan or finding a better Part D prescription drug plan, you could potentially lower your out-of-pocket expenses. Additionally, consider if your supplemental insurance still meets your needs, or if upgrading to a more comprehensive plan makes sense. Keeping a close eye on your medical expenses throughout the year can also help. Track your copays, deductibles, and prescription costs to see where adjustments might be needed. If possible, continue contributing to an HSA, which offers tax advantages while helping to cover unexpected costs. Taking the time each year to revisit your healthcare budget is a proactive way to stay in control of your finances and ensure you're ready for whatever comes next. Thank you for watching. If you found this video helpful, don't forget to subscribe for more advice and tips to keep your financial future on track. See you in the next video. Stay blessed.